Greetings, ladies and gentlemen. Welcome to the interview with the experts by the Malaysian Dental Student Association, MDSA. I'm your host, Shantini, representative of the Academic and Research Division of MDSA. Today, we are honored to have Dr. Rama here to share his experiences. A little insight on Dr. Rama. He is currently the consultant oral maxillofacial surgeon here in the UKM Medical Centre, as well as the full-time lecturer and the head of the master's program here in the dental faculty. So what are we waiting for? Let's go! Good morning, Doctor. How are you feeling today?
Fine, thank you.
Okay, great. Okay, Doctor, as a double degree holder in both Doctor of Dental Surgery and also Bachelor in Medicine, what inspired you to become more than just a dentist?
With regards to medicine, basically it was number one driven by passion. When I grew up, my parents always used to do a lot of social service, and one of it was medical camps for the poor. And I think they used to bring me at that time to just observe, and I used to just run around there. And along the way, I guess being Indians, coming from an Indian parents, where they always either ask you to do medicine, law, or be a teacher, right? So I worked towards that, but unfortunately, STPM result was not good enough to get a medical seat at that time. And I got dentistry, which was my fifth choice in my university application. So out of 5 choices, I still put medicine as my first choice, although I knew that I probably would not get it. So my first choice was medicine UM, second choice medicine USM, third choice medicine UKM, fourth choice was medicine UPM, and my fifth choice was dentistry UKM. So I got my fifth choice. Of course, initially a little bit disappointed, but because everyone tells you, it's okay, you're still going to be a doctor, you can still serve people. And of course, my family couldn't afford to send me to any private institution to do it. I still had that drive that I would still want to do something related to medicine. And that is why from the first day I entered dental school, I already knew I wanted to be an oral surgeon. Because everyone told me that it's the closest that you can go to being a medical doctor. And there is a pathway in which you can do a double degree. After I finished my specialization in maxillofacial surgery, somehow there was an opening where nowadays in Malaysia there is a little bit of awareness that maxillofacial surgeons would benefit from being double degree holders. Okay. And this is the pattern internationally as well. So I got to do medicine in Universiti Malaysia at the age of 35. Now of course subsequently as I enrolled and all, then I realized that it was more than a passion. So it was actually in me that I really wanted to do it. I always tell my students that cita-cita is one thing, making it a reality is another thing.
Okay, thank you, Doctor. Yeah. That's very inspirational. Next, as a consultant oral maxillofacial surgeon in the UKM Medical Centre, full-time lecturer and also the head of the master's program here in UKM, what challenges do you face on a daily basis and how do you overcome them? Okay,
challenges, number one, I would say is time. As you get older, there'll be a lot of other responsibilities that come in. Something that you need to learn how to balance. So for me, the biggest difficulty will be time. So I guess time management is very important. Easier said than done, but sometimes I guess the most important thing for me is focus. I always have a plan in my mind and I know what I want to achieve. So I do use a whiteboard. I always have what I need to do. You'll be surprised that you actually can do a lot when you have a plan.
Okay, so it's important to organize our thoughts and to prioritize what is important.
Yes.
Can you share a little bit about your research in the psychological aspects of oral cancer patients and their spouses?
What I started to realize was as I started working was the people that actually tend to bear the most burden whenever someone is diagnosed with cancer is actually the spouses or the family members. We call them the support system. So, and this group of patients are often neglected because they tend to feel guilty to voice out their difficulties because they feel that the person that is closer to them is having cancer, which is a life-threatening disease. So they most of the time tend to suffer in silence. So they don't even go out anymore because they think that if they go out, it will affect their spouse that doesn't want to go out. So I started to do that research in the hope of finding something that will provide more comprehensive care for not only the patient but the whole support system. So we started this research when I was a master's student in Hong Kong, and we found that actually it was very significant, where the spouses were having a lot of post-traumatic stress. So now we are trying to highlight this importance in our treatment planning. So we include the spouses in every aspect of the coping to help the patients cope as well. So so that was how the research started, and
Okay, very interesting, and good luck with that. As we all know, doctor, the dental or medical field can be very stressful if one does not know how to manage the time wisely. What are your other interests outside the dental medical field? And any tips on how to balance our time between work and leisure?
I'm a gym freak. I do go to the gym often. I get a lot of peace when I'm in the gym, and I run a lot. I tend to do long distance running. So for me, I use that as my outlet of de-stressing. Most people tend to forget that it is important that your body has to be healthy when you're in a course that is very stressful, such as medicine and dentistry. And there's a lot of stress inside building throughout the 5 years. And it doesn't end there, it continues when you start working. I always tell that a healthy mind is important, a healthy body is also important. I just try to at least spend an hour in a day, no matter how busy I am. So, did I answer your question?
Yes, definitely. Okay, so last but not least, doctor, would you mind sharing with us the most important piece of advice you have received so far?
Okay, the most important piece of advice which I received, I think, is probably from my parents. Always taught me to always stick to the important human values in life. Because I think having a principle in life is very important, especially when you're in the field of medical, where you have a lot of power to make decisions that can affect people's lives. Because trust me, when you start working, the pressures of outside will always come and make you want to fall on the easier side. It's always not easy to hold on to your principle because it might not be the popular decision. But like I always say, as long as you know that your conscience tells you that that is right, you must always stick to your principles no matter how difficult the situation may be. The people can always go away, doesn't matter. They can find someone else. But at least you can sleep well at night. No matter what you do, if you cannot sleep well at night, something is wrong. If you notice, I always have a hashtag mind over matter. So I strongly follow that, and I always believe a strong mind is what will get you through.
Thank you, doctor, for today.
Thank you very much. I would like to thank the Malaysian Dental Students Association for giving me this opportunity to share with you some little tips and perhaps important things that you can do to achieve greater success.